Hi everyone, my name is Grace Kostecki, and my research study focuses on the effect of counting your blessings on adolescent well-being and dispositional gratitude. I don't know about you all, but I know that I've definitely felt more stress since COVID-19 hit. Before the global pandemic, our teen lives usually consisted of an entire school day, followed by sports practices, extracurricular activities, and many hours of nightly homework. Now, as we continue to manage the COVID-19 health crisis, many of these stress factors are still present, along with even more fears about safety, uncertainty, and the loss of milestone events like proms and sports games that we looked forward to. Due to the stresses of school and teen life in general, adolescents have been shown to experience higher levels of stress than most adults. The 2015 American Psychological Association survey revealed that 27% of teenagers reported feeling extreme stress in compared to 20% of adults. In a 2021 American Psychological Association survey of more than 1,000 teenagers between 13 and 17 in the United States, 43% said that their stress levels have increased over the past year. Especially with the added stress and uncertainty of the COVID-19 pandemic, it was clear to me that it was necessary to find some sort of effective intervention for teenagers to improve their well-being. One intervention shown to be highly effective in improving adult well-being is gratitude, which works by helping one to notice the good things in life while curbing the acknowledgement of negative emotions, thus reducing the possibility of ruminating, a symptom of depression. While the practice of gratitude has been shown to improve overall physical and emotional functioning in adults, such as improving quality of sleep, attitude toward life, and resilience, there have been very few studies that have tested gratitude's effect on adolescents, who have been shown to be more prone to stress and anxiety. I also wanted to determine if practicing gratitude could increase one's dispositional gratitude. Dispositional gratitude is a trait that describes one's tendency to feel grateful. This means that if someone has a higher level of dispositional gratitude than others, they are more likely to feel grateful, not only after a specific situation, but also in overall daily life. Therefore, I hope to evaluate if practicing gratitude would increase dispositional gratitude, making participants more likely to feel grateful in everyday life. Because of this, I sought to answer the following. Can the practice of gratitude, specifically counting your blessings, effectively be used to improve adolescent well-being and dispositional gratitude? I hypothesize that if the gratitude practice of counting their blessings increases mental health in adolescents, then after practicing gratitude, students will have a measurable improvement in mental well-being and dispositional gratitude. 24 participants were recruited through a ninth grade Iolani health class. They were shown an instructional video and then filled out a survey with 3 questionnaires. The Warwick-Edinburgh Mental Wellbeing Scale, used to determine well-being, the Gratitude Questionnaire 6, and the Gratitude Resentment Appreciation Test short form, used to determine dispositional gratitude, were administered 3 times over the course of 4 weeks. As seen in the timeline, participants took the first round of tests, and the next 2 weeks consisted of a period with no intervention, in which the participants carried on with their daily lives. After the 2 week no intervention period, participants completed the second round of the same test. They then took part in the practice of counting their blessings. In this, participants took about 3 minutes of class time per day for 2 weeks to fill out a Google form with 5 specific reasons for which they are grateful. The intervention collectively took about 30 minutes over 10 days. At the end of the 2 weeks, participants took the final round of tests, once again including the same evaluations as those in the previous 2 rounds. During the 2 week gratitude intervention, participants filled out the daily Google form with responses such as, I am grateful for my French teacher because she is always upbeat and positive during class, and I am grateful for my school that provides everything for me, from being a part of their family to providing me a great education. In the WEM WBS, a questionnaire that measures subjective well being. Participants answered statements such as, I've been feeling optimistic about the future, and I've been dealing with problems well, with an answer of 1 concluding none of the time and 5 concluding all of the time. The WEM-WBS has established analytical precedents for interpreting scores. A score ranging from 0 to 40 suggests very low well-being, 41 to 44 suggests low well-being, 45 to 59 suggests average mental well-being, and 60 to 72 suggests high mental well-being. Results suggest an improvement in adolescent well-being scores after practicing gratitude. The average baseline well-being score was 45.42, and the average post-gratitude score was 50.2, resulting in an increase of 4.78 points, which was significant using the Wilcoxon signed rank test at p less than 0.05. Results showed that with an initial mean well-being score of 45.42 and a post-gratitude score of 50.2, the practice of gratitude statistically significantly improves adolescent well-being. Specific results suggest that the practice of gratitude can improve the well-being scores of all participants. All participants experience an increase in well-being after practicing gratitude seen in the table. However, the practice of gratitude improves the well-being of people with average or high well-being more than that of people with low and very low well-being. 27% of participants who initially scored in the level of average well-being scored in the level of high well-being after practicing gratitude. The GQ6, of which scores range from 6 to 42, and the GRAT short form, of which scores range from 16 to 144, were used to determine gratitude's effect on adolescent dispositional gratitude, which is one's tendency to feel grateful in daily life. Participants answered statements such as, I have so much in life to be thankful for, and if I had to list everything that I was grateful for, it would be a very long list. The average baseline dispositional gratitude score for the GQ6 was 27.42, and its average experimental score after practicing gratitude was 37.13, resulting in an increase of 9.71 points, which was highly significant at p less than 0.001 using the Wilcoxon signed rank test. The average baseline dispositional gratitude score for the GRAT short form was 102.92, and its average experimental score after practicing gratitude was 108.58. Results suggest that the practice of gratitude substantially increased all dispositional gratitude scores, with results suggesting that gratitude can increase one's dispositional gratitude regardless of one's score before gratitude. This supports the hypothesis that the practice of gratitude increases mental health and thus has a statistically significant effect on improving adolescent well-being and dispositional gratitude. Gratitude improved the well-being and dispositional gratitude scores of all participants, improving the well-being of students with average or high well-being slightly more than those with very low or low well-being. Because of this, people with very low or low well-being might need either a more rigorous gratitude practice, a different intervention, or possibly more support and care to improve their well-being. On the bright side, this study shows that practicing gratitude can improve both the well-being of all participants as well as their dispositional gratitude, suggesting that if you count your blessings 10 times over the course of 2 weeks, it will also make you more likely to be a grateful person in daily life. What's also remarkable is that participants counted their blessings for only 10 days, which shows that taking only 3 minutes out of your day for 10 days has a statistically significant effect on your well-being and your tendency to feel grateful. Another interesting finding is that although participants filled out the gratitude intervention in class, it was completed virtually through a Google form, and it still led to a measurable improvement in both well-being and dispositional gratitude. This is significant because it indicates that well-being interventions like counting your blessings can even be done in one's spare time without taking up class time and result in positive outcomes. It must be noted that a restriction of a small sample size and the single trial of the study could have attenuated the effects of the gratitude intervention. For this reason, it would be interesting to do further research to understand the effect of gratitude on a more diverse sample of the adolescent population. Another study could also be conducted with either a more diverse age group of adolescents or with participants from different schools to gauge the effect of gratitude. The diversity of participants in this study followed a normal distribution, especially with respect to well being. Other studies could be performed to gauge the effect of the practice of gratitude on the well being and dispositional gratitude of populations whose diversity does not follow a normal distribution. With results in my study showing that practicing gratitude really can improve one's well being and dispositional gratitude, it is important that these interventions are implemented into one's daily life to be used not only to increase overall well being and improve mental health, but also to manage the stresses of school and society. Because this also showed that a curriculum based approach to gratitude significantly improved the mental health of students, it is important that schools implement well being interventions like gratitude to combat the increasing amount of stress and anxiety in adolescents. In addition to that, the COVID-19 pandemic has definitely caused significant changes in our lives, which can lead to stress and anxiety. Not only is practicing gratitude important because of its effects on mental health shown in this study, but it is also important for us all to actively look for reasons for which we are grateful in a time where many of us feel like there isn't much to be grateful for. This is a positive approach that many of us can truly benefit from, especially in times like these. Working on this study for 9 months now has been a roller coaster, but it has taught me that I'm more capable than I realized. I came into this class being a nervous underclassman and having absolutely no idea what I was doing, but the whole experience taught me to be confident in myself and my abilities and showed me how much I truly can accomplish when I put my mind to it. I also learned the importance of being organized and on top of everything, but also just going with the flow. You can't predict everything that will happen in research, so it's important to relax and be ready to adapt to new situations. My advice for future students is to choose a project that you are passionate about. Going to research class every day was a blast for me because I was really passionate about this topic. So it was not hard at all for me to work on this project for a year. Also, research is definitely a difficult process, but there's truly so much to learn from doing research. So don't give up. I would like to thank my mentors, Dr. Chan and Dr. Lei, for being so incredibly supportive. I am especially grateful that Dr. Chan met with me numerous times over winter break and even on Christmas Eve to teach me how to code for this project. I want to thank Mr. Sagawa and his health classes for being so cooperative and eager to help me with this study. I also want to thank Dr. Nathan Murata and Ross Oshiro for helping me with my project design and for their encouragement and assistance. Lastly, I want to thank my parents and my brother for the never ending love and support, and for always asking me if I needed snacks when I was working on my research late at night. Thank you so much for coming, and don't forget to count your blessings.